I saw online that ice water is back, and ice water is just a random water you just maybe from the tap or from the well you put inside this nylon that used to make moi moi, and you people start selling. You put it in the freezer, it freezes, and you have your cold water. Now imagine how that would affect our health. How are you today? Welcome to another episode of Health Simplified with TSA. What are we looking at today? Today we'll be looking at how this current state of the nation is affecting our health. To a large extent, our health as a community or as an individual is influenced by so many determinants of health.
I was suspecting it.
And generally, we have the social determinants, we have the economic determinants, we even have a behavioral determinant. These things influence our health one way or the other. From the individual perspective, let's talk about purchasing power. I want to believe that this has affected the way we purchase things. You can have ₦1 million and the million is behaving like 100,000. And at the same time, the quality of what you're buying is not as it should be. And this might make us to compromise on quality of food or of clothing or of things we drink. For example, a bag of sachet water used to be $2.50 thereabout, but now it's like $400.
Yes.
Now think about communities, think about families that can't really afford to buy this water. And what does that do? It's either they boil water, but guess what? The cost of buying electricity might even make them to not want to boil water with electricity. Now, you would think that they would boil water with maybe gas or with kerosene, but they are all expensive. They might have to drink water coming from the tap directly. And we really don't know how hygienic these pipes are. And really, it's something to think about. I saw online that ice water is back, and ice water is just a random water you just maybe from the tap or from the well you put inside this nylon that used to make moi moi, and you people start selling. You put it in the freezer, it freezes, and you have your cold water. Now imagine how that would affect our health.
God have mercy upon us.
If it's not purified, if it's not clean water or potable water, it tends to affect our health by drinking unclean water. This affects our health in that regard. Bringing it to food. Initially, we've preached that we should eat healthy meals, we should eat a balanced diet. But in the real sense, if we even get to eat rice, it's something to be thankful for. But the economy, the state of things is really affecting us. We are susceptible to eating food that is not really hygienic, but just because we need to survive. Our health consciousness in a way is going to be put aside. Another thing is it can affect our accommodation. It can affect housing. Someone that has not been able to eat would not even be able to, maybe might not be able to pay rent.
Food is the most important thing, don't you agree?
You need to sacrifice one thing or the other. Do you want to sacrifice your food or you want to sacrifice your rent? Some people might have to be thrown out of their homes because they cannot afford to pay their rent, which is really painful and emotional at the same time. Also, the state of things in Nigeria is affecting our social relationship. As an individual, you find it difficult to even reach out because you yourself, you're not happy. It is when you're happy to gist, you're happy to talk about things, but rather you hear people talk about, I've not eaten, I need to borrow urgently, I need to do this, I need to do that. And because of self-pride, sometimes you might not even want to ask for help. This is affecting us as a community, as an individual, as a nation. We are really going through a lot. The state of the nation is also influencing gender-based violence or intimate partner violence. How do I mean? If a woman does not have her own means of source of income, she is likely to be dependent. It's not even a matter of likely. She is dependent on the man. And if the man has been an irresponsible man, a man who beats her, she won't have anywhere to go. She just has to stay just for her to be able to eat. And it's really painful. Her heart bleeds. It's hurtful. But this is what is happening. People are dependent on things to survive, and they have to survive. But how long can this be before we lose a woman to gender-based violence? We need to step up. Please, if you can help, please help. If you can refer to human rights community, please help that woman that might be going through that. We can't really blame women who are staying in an abusive relationship, even for a single man or for a single lady. A single lady is likely to live or cohabit with a man because she can't afford her own rent. She's likely to just stay there even if she doesn't like what is happening in that relationship. If the man is beating her, she has nowhere to go. And she stays there. This is affecting us. This is affecting everybody. How about talking about our aged? How are they managing their health? Some of our aged have diabetes, they have hypertension, they have rheumatism, they have arthritis. To mention a few, how is this state of the nation affecting them? Sure, some of them some are dependent on their children to help them to buy some of the medications they need to manage their health conditions. But what happens when that child is not even able to extend finance to their parents or the aged? How are they supposed to manage? Rather, they will have to just bear the pains. How are they even coping? How are they buying food? How are they taking care of themselves? I'm a bit emotional about this topic because it's so overwhelming, but I'm bringing this to our knowledge to see how these things affect our health.
Because I hope you feel the same.
Say health is a complete state, but mentally they are not fine. Emotionally, we are not fine. How is the state of the nation affecting children? Children are expected to eat balanced diet. Children are likely to be malnourished because their parents cannot afford to give them some of these healthy foods that we have. And it's affecting the quality of health. Our health is like a small thing wrapped in a bubble of different determinants. And what do? Yoruba will say, "Kí àgbàdo tó dé ayé ń jẹ." I don't know how to interpret it. Please, if you can interpret, please help me. What that means in literal terms is that before all the luxury that we have, before buying all these things, there's something we've been doing before all these things. And to help us to practically support ourselves, be creative with your food. Put everything that will just help to augment some of these nutrients. If that's what you can do. In terms of finances, really we might not have enough. We must be prudent with spending, prioritize, and about our social health, try to reach out to friends and family, even if it's just talking about the state and how it's affecting you. Trust me, it has a way of also alleviating your pain, your feelings. So in conclusion, this episode is just to help us to see the relationship between the state of the nation and our health. If you have ideas or if you also have other ways we can relate the state of the nation with our health, please feel free to share in the comment section. Please subscribe and share this episode. I stand with you. God bless Nigeria. I love you. See you in the next episode. Bye.